All right, welcome. Thank you so much for being here. I'm Dr. Noah Volz. I'm a chiropractor in Ashland, Oregon. And today we're going to be talking about what's commonly referred to as tennis elbow or a lateral epicondylopathy, sometimes called lateral epicondylitis. I'll talk a little bit of why I don't use that term and don't think it's a correct terminology for what's really happening. And we're going to talk about using shockwave therapy. I'll tell you all about shockwave therapy, how it works, and why in my clinic this has been a game changer for people with this condition. It's a condition that doesn't really respond very well to a lot of other types of therapies. And so I've developed a program to treat this effectively. And so far, using the shockwave therapy, we've been getting amazing results with people and helping a ton of people that in some ways were kind of hopeless and just thought this would never go away, or had careers that they felt like was just going to keep aggravating this area and there was not much they can do. So I'm excited to share everything with you and help you decide if this is a therapy that would be useful for you. So, oftentimes people who have this tennis elbow, they have trouble gripping things. They have trouble, doing their jobs, whatever that may be. And so the question is, what if in 5 weeks you could, get back to gripping things like you used to? And in order to answer that question, we're going to talk about why tennis elbow becomes chronic. We're going to talk about shockwave therapy and what it does differently than the other treatments that are out there and why it's so effective. I'll bring up some patients that I've treated with this approach so you can get an idea of what to anticipate. And then I'm going to introduce you to the 5-week protocol that I use with people to help them get better. So let's talk about tennis elbow. So it doesn't affect that many people, 1 to 3% of the population. Most people are not tennis players. And the most common cause is repetitive computer or phone use, or really any repetitive movement that uses the forearm. And it can last a long time. I've seen patients where it's lasted years, others where it's lasted months. And most of the people who come to see me have tried, especially for this therapy, they've, in their own words, they've tried everything. They've done chiropractic, they've done massage, they've done acupuncture, they've done physical therapy. They've tried all of the things that they can think of, and they haven't been able to alleviate this. And so that's usually when people find me and this particular approach. This disproportionately affects computer workers, manual laborers or tradespeople, and certain athletes, tennis, golfers, weightlifting. It really has a strong correlation with gripping movements or gripping things. I've seen a lot of massage therapists, estheticians with this, where it's become chronic, and we've been able to help all of them. So let's talk about the traditional treatments. I mentioned all of those things that many of my patients have tried and they've had minimal results with them. Non-steroidal anti-inflammatories, either over the counter, even the natural ones, the quercetin, curcumin, boswellia, all of these usually only have minimal results. The braces They do definitely help. I often recommend them in conjunction with the treatment, but they don't seem to get people over the finish line. They don't seem to take people all the way to full recovery. Cortisone injections are sometimes used for this. This does weaken the tendon long term, especially at a certain dose. So it can get you out of pain, but it doesn't seem like the best long-term solution because you're causing some damage. Physical therapy, your physical therapy is only as good as the provider who's providing that physical therapy. And so some physical therapists can get some pretty good results with this, but most people have had limited success with physical therapy. It hasn't really, it may have helped, but it hasn't really resolved the problem. And then, some people even go and get surgery for this, especially if they've identified something through the MRI or the diagnostic ultrasound that's wrong in that area, then they go ahead and get surgery. And that has its own set and list of complications and, may not actually solve the situation. And so let's talk about the situation itself. So, tennis elbow at the cellular level. What's really happening? So, tennis elbow used to be considered epicondylitis. That's an inflammatory condition of the tendons and ligaments around the outside of the elbow. And now we're finding that at some point there probably was an inflammatory process, but now it's more of a degenerative process. It's kind of an overuse injury. Some of those tendon fibers have been degenerating over time, and so there's some micro tearing and scarring that can happen in the tissue, and because of this, that limits the blood supply that these tissues are able to get, and so there's a failed healing response. If you don't have adequate circulation in that area, it's extremely difficult for the body to heal itself. And so the takeaway, you can't treat degeneration with anti-inflammatories. And most of the approaches out there are anti-inflammatory. Shockwave therapy does have an anti-inflammatory component, but it also does a lot of other things that directly treat and target these tissues, these cellular mechanisms in the area. So, what does shockwave therapy do? Well, first, let's back up. Let's talk about what it actually is. So, shockwave therapy has been used in Europe for a long time. It's just now starting to become more popular in the United States and used for many musculoskeletal conditions. There's a lot of different types of units out there. You might hear piezo wave or soft wave, shock wave. There's probably a bunch of other ones that I'm not familiar with. But they all pretty much do a very similar thing. So if we think about ultrasound, ultrasound is basically sending a heat wave through the body or to a certain depth. It doesn't penetrate all the way through the body. And shock wave is sending an acoustic wave through the body. And this acoustic wave mechanically stresses the tissues and can stimulate a healing response. So when it manually stimulates those tissues, it can break down scar tissue. It can stimulate new blood vessel growth. And it can stimulate the activation of stem cells. It can also promote collagen synthesis. And in terms of treating the lateral epicondylopathy or the tennis elbow, it has an 85 to 95% success rate in clinical studies. So In my opinion, if you haven't tried this, you got to try it. It is excellent. It has worked so well for so many of my patients who've had this chronic condition and haven't found anything to help. So, some of the reasons that it works so well is especially the radial shockwave, which is the one that I offer in my clinic here, is it penetrates to the exact depth of the lateral epicondyle where the problems are. It can target precisely the trigger points that are in that area, the musculotendinous junction in that area, and it stimulates healing without any tissue damage, which some of the other interventions can cause tissue damage. There's very little side effects. Sometimes that area will be sore or slightly uncomfortable, but there's no real downtime. And the results are permanent. Once we heal that tissue, it's healed. And it's not like you need another round in the near future unless that tissue gets damaged again. And of course, we do an assessment and we test things along the way just to see the improvement that we're getting with this approach. So let's look at some of the research here. There's a lot more research. There's just a few of my favorite research studies. This one is specific to Shockwave for lateral elbow tendinopathy, which is exactly what we're treating here. And there is some mild discomfort, but we found that muscle strength increased. We found earlier pain relief, and so we just found that this was overall a really successful intervention for people with this. So then, again, another study, shockwave therapy for lateral epicondylitis. You can see there's a lot of different names that we use for this specific condition. So we had great pain reduction. 60% of these people had a decrease in their pain reduction. The classical treatment group, only 37%. And then with ultrasound imaging, it was noted that there was a reduction in inflammatory markers with the shockwave therapy. 26% of the people experienced that, as compared to the classical treatment was 14%. So classical treatment does work. Based on this study, it appears that the shockwave therapy works better. So some more research studies here. This is all about stem cells. This is what I am personally most excited about when it comes to the radial shockwave therapy. So there is an increase in the growth and self-renewal of human bone marrow mesenchymal stem cells. This was in a lab, so we don't have any in vivo kind of studies on this specifically, but still the fact that we have something that can affect the stem cells, that's not injecting stem cells into the body, I think is a very positive intervention that's non-invasive. And so those mesenchymal stem cells were more metabolically active, and they were encouraged to turn into bone cells, not into fat cells, which can be a problem if there's fatty striations in the tendon or in the muscle that can delay healing. And they also found that the cartilage was healed in this study. The mesenchymal stem cells helped to heal the cartilage defects. So this is what I'm most excited about. Again, we still need a lot more research in this category, but this is a powerful way that's non-invasive to stimulate the stem cells in that area. So one of the reasons I think that the results that I'm getting is so much better than the other options that are out there is because of the specific equipment that I'm using. A lot of the research was done with this equipment. Because of the specific protocols that I'm using. I'm very data driven. I like to measure everything and track the results and progress that we're getting. I also utilize the global rehab and injury prevention approach, which does a functional range of motion assessment and helps me to identify the specific tissues. We call this targeted structural interventions that need to be treated in the elbow. So you can have somebody who has a Shockwave machine who's just rubbing that Shockwave machine over your lateral elbow, or you can have somebody who's taking a very targeted approach, looking specifically for the tissues that have been damaged and approaching those with the Shockwave equipment in a very targeted way in order to get those tissues to function properly again. And oftentimes I work on the other contributing factors, whether that's the wrist or the neck or the shoulder. All of these can contribute to the stress that's happening in the elbow. And by treating those, we can improve results as well. So in terms of this 5-week tennis elbow protocol, there is the biomechanical assessment that includes a orthopedic and neurological assessment that just gives me and then my team the information we need to develop a customized and personalized treatment plan using the radial shockwave equipment. Then we do 20 to 30 minute sessions of radial shockwave in that area and adjacent areas, depending on what we found and what needs to be treated. This is using the grip approach and the targeted structural interventions, so we can be very specific with the tissues that we're working on. Also give people some global reset strategies to retrain the motor control patterns of the elbow so that their elbow can function optimally and you're not increasing other compensations in the elbow. And then after the treatment, there is a progressive isometric strengthening program that we go through to strengthen the tendons that have now been healed so that there's a less likelihood of recurrence in the future of this condition. Also providing some ergonomic suggestions or technique modifications to help minimize the stress and overuse in that area. And then we do some return to activity planning. So figuring out what a realistic timeline for you to go back to your pre-injury levels of activity are and figuring out what the best approach for you to do that is going to be. So this isn't really going to mean much to you, but I think it's just important to know that the research shows very specific parameters for healing of tennis elbow. And so we follow the research-based guidelines in terms of the frequency, the number of hertz that we're using, the pressure, the number of bar that we're using. Of course, we have to modify this for tissue tolerance and work up to these specific parameters. But this is really what we're shooting for because we found that this many pulses at these parameters provides the largest dose of a healing response. And so we want to continuously move towards that whenever possible. And then using the targeted structural intervention on those specific areas at a specific angle so that we're treating the tissues that really need to be treated. And then we progressively increase the settings on the machine, which increases the intensity, and that higher load on the tissues allows those tissues to be able to withstand kind of the normal loads of your daily life, which is ultimately the goal here. So let's look at some cost comparisons here. So conservative care, maybe $2,000 to $4,000, and sometimes the conservative care works. You know, the acupuncture, massage, chiropractic, physical therapy. The biggest thing I've noticed with that is the resolution is uncertain. They don't have an 85 to 95 success rate like shockwave therapy. Surgery, it's pretty rare. I don't, it can, be recommended, but it's often not the best approach, primarily because it's, there's a lot of lost time, even if your insurance covers it. That recovery time, there's some lost wages and a lot of downtime. And then if you've had this for a while, you've noticed that there's a decrease in your productivity and a decrease in the amount of activities that you're able to use or able to do. And so this lost productivity, some people who come in to the clinic are feeling pretty despondent and like they've run out of options. And so the idea of 5 weeks to a full recovery and being able to get back to life is really appealing to them. So that's what we're offering here for chronic elbow pain. So there is some limited availability with this treatment. It's been so successful, and I've had so many people signing up to be part of the treatment that we don't have as much availability as we'd like. We are looking at ways to scale up this treatment so we can serve more people, but there are some constraints around the availability. So if this is something that you might be interested in, I highly recommend reaching out to the clinic so that we can ensure that we can get you in a timely manner here. So this is how you'd reach out to the clinic. You can call the phone number. I also have online booking on the website. You can visit the office if you'd like as well. And I hope that this lecture was useful to you. I hope you learned a little bit about shockwave therapy and its effectiveness for tennis elbow. And hope you, if you are struggling with this, I hope that you will contact me or my team so we can figure out if this would be a good approach for you. And I thank you for watching this lecture, spending your time with me, and I look forward to seeing you in the future.